Have you ever thought that why is there a sudden rise in number of heart attack cases and heart related deaths since a few years? You must have got this thought somewhere around your life since quite a many years, because there is a rise in number of cardiac deaths, especially among quite a many young patients. And if you have got this thought ever, this video is for you. Hello friends, I am Dr. Mehta, a consultant physician, diabetologist and a critical care specialist, and you are watching Doctor Plus, where I'll be a doctor plus something more, and we'll be talking everything about good health and everything good about health. So, why are there a sudden rise in number of cardiac events since a few years? We are observing a high number of cardiac deaths a few years in patients who are in their 40s or even 30s. So was it really common earlier and is it getting highlighted nowadays, or was it actually uncommon and it is getting common nowadays? And is this thing a major concern for our healthcare? We'll be talking all about this in detail, so watch the video till the very end. So if we want to cut down a long story short, the answer is yes. The cardiac cases are getting commoner, and complicated cardiac cases, which results into morbidity or mortality, that means death of the patient, are getting more and more common these days. Also, it is important to note that these events are getting more and more circulated in the news and social media pages, but there is a sign of a bit rise in such cardiac cases since few years. So what's the truth? Now the truth is, the heart attacks or the cardiac events in younger people were not so rare in the past. They were found, but again, it was more common in younger patients who were in their 30s, but it was more specifically occurs in males. And it is very, very uncommon to have such cardiac events in female patients. And why is it more common in males? There are a lot many reasons. These reasons are primarily physiological, that means they are related to the physiological, that is the natural build of males and females, and so basically we can't do anything about it as far as the physiology is concerned. It is just a way that, for example, females are more prone to thyroid disorders as compared to males. In the same way, males are more susceptible to heart attacks. But the only major concern that we are having right now is the cardiac events are getting a bit more common than they were in the past. And why the number of heart attacks are rising these days, especially in younger patients, and why is there a sudden rise in cardiac deaths? It is because it is getting more common in younger people. Now, you'll be surprised to know that younger people, while suffering heart attack, are more prone to die as compared to older people. Shocking, right? Now, this means that a similar severity of heart attack, if occurs in a 35-year-old male and 85-year-old male, the chances of survival for 85-year-old will be higher as compared to that in a 35-year-old male. Now this is something really shocking, right? But by the end of this video, you will be surprised to know how our physiology works. So now let me explain this thing, why this happens. So basically, what is a heart attack? A heart attack is a thing that occurs because of a complete block of any of the three major vessels, blood vessels that supplies the heart. Now these blood vessels take blood to the heart muscles so that they can pump effectively. Now if there is a complete block, that is 100% block in any of these vessels, it is called a heart attack. Now so if these blood vessel is blocked, the muscle that it supplies stops working, and by that the pumping of the blood stops, and that causes death because of the heart attack. Now here is a catch. What if the blood vessel that is blocked has several smaller branches, but now here is a catch. The bigger vessel that is blocked has several smaller branches that is attached to the muscle. Now if the bigger vessel is blocked, the blood may bypass through those smaller vessels to the muscle, and it keeps the heart pumping. It doesn't let the muscle die basically. Now no doubt the complete efficacy of the heart cannot be attained, but it does the job. Now the chances of these branches that are formed is quite high in those patients who are older. Now these branches are called collateral circulation. That means the branches takes a hell lot of time to be formed. The density of these branches is quite higher in older patients. So for the 85-year-old male we were talking about would be having a very dense network of these collateral circulation, whereas the 30 or 40-year-old male might not be having an adequate collateral circulation, or he might be having a nil collateral circulation. So if a severe heart attack occurs, the 85-year-old male will be saved because there is an alternative way for the blood to pass, but the younger male will be succumbed. Again, I would like to mention here that it is one of the major factors that decides survival in heart attack patients. However, it is not the only reason that decides survival. Also, there are many other reasons that decides the occurrence and progression as well as survival of younger patients out of heart attack, and even the incidence of heart attack in younger patients. And these factors are: number 1, lack of exercise; number 2, intake of high calorie junk food containing high amounts of salt; third, unhealthy lifestyle; fourth, stress taking behavior; fifth, intake of narcotic drugs, smoking, and even tobacco chewing; unsupervised weight training exercise and intake of steroids, caffeine, and counterfeit health supplements; seventh, a strong genetic history of heart problems in the past. So I'm pretty sure you must be clear with what all this fuss about heart problems and heart attacks is. I'm Dr. Jay Mehta, signing off for today from Doctor Plus, where I'll be your doctor plus something more, and we'll be talking everything about good health and everything good about health. Do subscribe to our channel, do like the videos and share the videos to everyone you feel this video might help. Also, do comment your doubts on health and disease. I'll be more than happy to help. See you till the next time, and do take a very good care of yourselves. Bye.